Good day, everyone. I am Daniela Soneja, and for today, I will be discussing to you about changing an IV catheter to an intermittent infusion lock. Before we proceed in changing the IV catheter to an intermittent infusion lock, let us first know what is IV catheter and an intermittent infusion lock. So, IV catheter IV catheter or cannulas are indwelling single-lumen plastic conduits that allow fluids, medication, and other therapies such as blood products to be introduced directly into a vein, while intermittent infusion lock, also called a saline lock, is an intermittent infusion device consists of catheter with an injection cup attached, filled with saline solution to prevent blood clot formation. The device maintains venous access in patients who are receiving IV medications regularly or intermittently but who don't require continuous infusion. Okay, let's proceed to the process. Changing IV catheter to an intermittent infusion lock. Purpose of the procedure: to permit IV administration of medication or fluids to an intermittent basis. Assessment: patency of the IV catheter, appearance of the IV catheter, appearance of the sites, evidence of inflammation or infiltration. Planning: a specific order may be written to convert an IV access to a saline lock. The order also may be implied, for example, IV fluids are to disconnect are to discontinued but the client has an order for an IV antibiotic for every 6 hours or is receiving analgesic intravenously. From the primary care provider's order, determine the type and sequence of intermittent infusion, and review the client's record regarding previous infusion and use of infusion device. Note any complication and how they manage. Equipment: intermittent infusion cup or device, clean gloves, TSM dressing, sterile 2x2 or 4x4 gauze, sterile saline for injection without preservative in a prefilled syringe, a 3 ml syringe with a needleless infusion device, isopropyl alcohol wipes, and a clean MSS basin. Delegation: due to the need for sterile technique and technical complexity, this procedure is not delegated to UAP. UAP may care for clients with such devices, and the nurse must ensure that the UAP knows what complication or adverse signs should be reported to the nurse. In many status, a licensed practical nurse with a special IV therapy training may manage intermittent infusion devices. Check all the Nurse Practice Act. Implementation: under implementation is the preparation. Obtain the needed equipment and take to the client's bedside. Let's proceed to the performance. Number 1. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how can he participate. Explain the reason for the intermittent device, and an IV to a saline lock should cause no discomfort other than associated with removing tape from the IV tubing. Uya po sa number 1, dita po permilingwan na mag-introduce ning sa dilita sa client po. For example, malawag po kita sa pasyente tatas tayan po kita ning, "Good morning ma'am, good morning sir, I am Nurse Daniela po," ganun po. Tapos, syempre po, permita pong ihapot kung sinda ito, kung yung pangalan ninda, tas yung birthday nin data. Ang mga hospital, ito ang yagamit na pag-verify ning patient. Then, explain. Bago kita magpuuning maski anong procedure na gigibon ta sa patient, itatayam ta sa inda kung ano ito para aware sinda and makaka-operate sinda. Next, number 2, perform hand hygiene and observe other appropriate prevention procedures. 3. Assess the client to a comfortable position. Expose the IV site but provide for any client privacy. 4. Assess the IV site and determine the patency of the catheter. If the catheter is not fully patent or there is evidence of phlebitis or infiltration, discontinue the catheter and establish a new IV site. Next, expose the IV catheter hub and loosen any type or dressing that is holding the IV tubing in place or that will interfere with insertion of the intermittent infusion plug into the catheter. Clamp the IV tubing to stop the flow of IV fluid. Then open the goose pad and place it under the IV catheter hub. This absorbs any leakage that might occur when the tubing is disconnected. Then open the alcohol wipe and intermittent infusion plug, leaving the plug in its sterile package. Number 5. Remove the IV tubing and insert the intermittent infusion plug into the IV catheter. Apply clean gloves. Then, stabilize the IV catheter with non-dominant hand use the little finger to the place slightly pressure on the vein above the end of the catheter. Twist the IV tubing adapter to loosen it from the IV catheter and remove it, placing the end of the tubing in a clean emesis basin. Then pick up the intermittent infusion plug for its package and remove the protective sleeve from the male adapter, maintaining its sterility. Insert the plug into the IV catheter, twisting it to engage the lower loop. Number 6. Instill saline per agency policy. Saline is used to measure patency of the IV catheter when the fluids are not infusion through the catheter. The intermittent lock will need to be flushed with a prescribed solution after each use or every 8 to 12 hours if not in use, according to agency policy. Some recommended flushing the lock by injecting saline using the push-pause method, a rapid succession of push-pause-push movements exerted to the plunger of the syringe barrel, with the rationale that this creates a turbulence within the catheter lumen that causes a swirling effect to remove any debris attached to the catheter lumen. However, no research supports this method of flushing. There are different opinions and practice regarding this type of flushing versus a smooth injection of the flush solution. Number 7. Cover the site with a TSM dressing. Rationally, the thumb dressing provides protection from infection, allows for ease of assessment of beneficiary site, and also promote comfort, preventing the plug from catching on clotting or bedding. Number 8. Remove and discard the gloves. Then, hand hygiene. 9. Teach the client how to maintain lock. Then, number 10. Document all the relevant information, record time and date when the infusion device was converted, and status of the IV insertion site and any adverse responses of the client. Don't forget to document every procedure that you will be doing to the client. Maski ginibuta po ito sa client, kung dito sinurat or tig-document, counted po ito na daig, maski ginibuta po. And evaluation, perform follow-up based on findings or outcomes that deviated from expected or normal for the client. Relate the findings to previous data if available. Examine the IV site at regular intervals. Note patency and ease of flushing. And lastly, report significant deviation from normal to the primary care provider.